Hello, everyone. I'm Michelle Strange, and this is season 3 of the Level Up Infection Prevention podcast. This season is all about digging into the details that make infection prevention both challenging and rewarding. And today we're diving into some legal sides of infection prevention, patient safety, just all of that jazz with an amazing guest, Olivia Wan. I do want to just say she's an expert in this field, but Olivia Wan is the presenter. I tell the story all the time, but she is the presenter that came to South Carolina where I was like, oh, I can learn infection control and not want to stab myself in the eye because out of boredom. It was the most fabulous presentation, and it was what the impetus to me loving infection prevention. And so I'm always so glad to have you on, Olivia. How are you?
Good, good. Thank you, Michelle. And I appreciate that warm introduction. And I've been amazed to watch you over the last few years and how you have just really risen to the highest level so quickly. So
Oh,
just want to praise you and your hard work and what you're doing.
well, thank you. It's because I have lovely people like you that are willing to come on and teach me things. Olivia, tell us a little bit about what you're doing, what you do in this legal side of dentistry, and give us some of the tea.
We were talking earlier, Michelle. I've been at it a long time. So I
Yeah.
earlier, I worked for a dentist for 14 years, and then I decided to go into professional consulting. So this is actually my 25th year as a
Wow.
consultant. Time flies when you're having fun. And I've been practicing law 13 years. And so I've been able to marry the how you say the consulting profession to my law firm, where I do represent quite a number of dentists, not only as a consultant providing them assistance with OSHA HIPAA, but then assisting dentists when they have regulatory compliance errors, blunders, board complaints. And so I think it's important for people to tune in to podcasts like this so they can learn how to avoid those situations.
Absolutely. So I would love to hear some of the things that you're talking about these days.
Yeah, this last year, quite honestly, I've had more board complaints and HIPAA violations. Lots of
Oh,
violations that relate to right to access. And I don't know why, Michelle, it seems pretty simple. If a patient requests a copy of their record, why are dental offices taking so long to send them a copy? It's their information. And when copies are not provided timely, they'll either go to the board and make a complaint, or worse, when they complain to the OCR, because that is federal law, and there's hefty fines and penalties associated to that.
and in this season of the podcast, we had Amy Wood on talking about some technology, IT backups, and some HIPAA things. So that's interesting. That's what you're seeing it
Well,
as a HIPAA.
it goes in, how would you say, seasons. I don't know
Oh,
what year will bring, but I've had years where it was infection control issues or OSHA compliance issues. Now, Michelle, with that said, I have made it my personal goal and that of my team for this next year to really go into deeper details with infection control. A lot of times these offices only give us maybe 2 hours to do OSHA HIPAA training for their annual update, and it's not enough. It is when I started my career, we did a 6 hour session. And doctors are like, oh, it's too long. How do we summarize it, get the bare minimum? And I've noticed over the last few years that infection control is suffering. When we do the audits on site and we measure what they're doing compared to the guidelines, CDC guidelines, it's a little bit disappointing, especially when team members might be resorting back to older habits, or because we're in a labor shortage, they're cutting corners. And so we're going back to the basics for this next year and going more step by step with instrument management, surface disinfection, and trying to really assist a hygienist and dental assistants in the trenches because they are overwhelmed. not only with patient care, but with these other duties that relate to patient safety.
And so one of the things, and you could definitely correct me if I'm wrong here, is that a lot of people have this like mindset around patient safety of no one's gotten sick before. This isn't an issue. If this was a bigger problem, we'd hear more about it. Is that something that you hear too?
I do, and I think that some of these offices that are not in compliance are, how would you say, lucky that it wasn't traced back to them. And perhaps with more of the litigation cases in the media, who wants to be that next case study? Who wants to have their name
Mm.
published? And I don't, Michelle, I don't know if you've seen this as I have, where several years ago, there was a dentist who had a complaint filed with the Board of Health. And I followed that case closely because it wasn't OSHA that went in randomly or with alleged violations. It was the Board of Health. And the Board of Health brought in the dental board, and the dental board contacted OSHA. And when I looked up this doctor's case months out, then it even resulted in insurance fraud allegations. So it can have
Oh,
a
yeah.
domino effect. So if you think about it, if they're doing something knowingly wrong in their practice, such as maybe not sterilizing the instruments correctly, what else is wrong in that organization?
And that's actually, I love that you bring that up because the thing that I say when I look at people in PPE issues, they don't doff properly, they don't even wear the right PPE, they don't wash their hands after at certain times throughout care. I'm always like, what else are we missing? Because that's the simple side for me. Wash your hands. And if you're not washing your hands, what else are we forgetting or skipping through or cutting corners on?
And some of the states do not require the dental assistant to be registered or licensed, the entry level assistant. And that concerns me because if that individual has not had training in the science of infection control and prevention, then it may not be as common sensible to practice the things that we're told to do. So it's important that whoever is in that practice take on a leadership role to train these newbies. And I love that more and more state dental boards are requiring that infection control is part of their CE component. And I wish that every state would adopt those requirements.
And we're seeing a lot of that now around waterline management and maintenance because I feel like it's because of the lawsuits and the big things that we saw come from that. Would you agree?
Oh, hands down. I mean, like, the state wants to have their dental offices featured in forefront of having the
Massive lawsuits.
as 200 patients filed a class action lawsuit. So I think that the state should be very proactive in requiring it. For example, I'm in Tennessee, and Tennessee requires chemical dependency in prescription writing. I wish more states would add infection control. And with the waterline monitoring and different standards that have been enhanced, we need to stay current. And the thing is, you may have learned something a couple years ago, but we want these important concepts to rise to the top again. And that's through ongoing training and inspiring them.
Are there some common issues or concerns or things in the legal space that keep coming up time and time again, like waterline maintenance or hand hygiene? You said HIPAA, but I'm curious if there's anything in that infection control space.
I've had quite a number of cases that I've handled where the allegation was that the dental office was not heat sterilizing the hand pieces. And at this point, I'm getting,
Oh, yeah.
because how many years has it been the guide to heat sterilize the hand pieces between patients? And so we want to make sure that's part of our infection control plan. Also, the instrument packs, when we do site audits, the packs are not labeled. There's no date on it. There's no indication which sterilizer was used, or there's no chemical indicators. We might be missing biological monitoring records. And those are some of the common violations that we see. Now, looking back, I was interested in this North Carolina case. I don't know if you read about it, but the dental board investigators showed up unannounced and the dentist was allegedly, that's always the legal language,
Oh,
allegedly found reusing instruments. There was cockroaches in the dental
yeah.
office. Gloves
That
were
was the one.
and the dentist agreed to license suspension, and I thought it was quite weird that this had happened a couple of years before that. So very sad that this comes up and it ends up being published, and hopefully we take lessons from it and not put ourselves in that situation. But dentists have had their license suspended if they're not in compliance with the state dental board. The board has teeth. They can come in and discipline. Typically, Michelle, when I'm looking at these consent orders, the board will require that the dentist pay for fines and penalties, but the discipline will consist of taking, for example, 8 hours of infection control training.
Mhm.
And then they'll be under a monitoring program for 12 or 24 months where they have to check in with the board and provide documentation.
Okay. Yeah. Do you think that we would see any changes if dentistry was a little more regulated, like a hospital setting?
No doubt. We all love to have autonomy, just like I do at my law practice, my consulting firm. We all love that. But it is unfortunate that some of those that are out there, they risk losing it by not being in compliance. So hospitals are heavily regulated and
Mhm.
they submit to JACO inspections. And I believe that if dental offices were subject to that, they would really be on their game. I don't know if you remember, Tennessee had random audits as a part of the local emphasis program a few years ago. And it was painful because OSHA officials were just walking in unannounced doing inspections,
Wow.
and dentists were not doing well. And it was quite interruptive to their practice. Plus, they had fines and penalties. So I think that, yes, if it was more rigid, we'd be in better compliance. But I wish that internally that we can find the ambassadors, people like you, Michelle, that take it so seriously. We need at least that one individual internally that can that's passionate about the material, inspires, trains. And the other important point is hold people accountable.
So true. So true. And is this the infection control coordinator that or infection prevention coordinator or whatever term you call it in your
Yeah.
office, OSHA safety officer?
A lot of times it's combined. The OSHA
Mm,
person and the infection prevention person is the same thing, perhaps not so in a large DSO environment. But we need to have these people. And like when we walk in, people are scared. Oh, what is she doing here? But I remind people, hey, we're on your side. We're on your side to make sure that what your practices are is aligning with CDC,
mhm.
OSHA, the dental boards, and so forth. I looked at one case for our program this year where the allegation was that the dentist had multiple violations and refused to let the inspection take place. One of them even locked the inspector outside.
Can you do that?
It's just,
I guess you can shut your door and not open it.
yeah, it's like automatically saying, okay, I lose. It's okay.
Right?
I don't want you to look around.
Oh my gosh. They're like, "Nope, not today, not in my office."
Just
Oh
knock
my
them
gosh.
outside, and that's not good. Yeah, encourage people to take advantage of resources that we have. CDC has the dental expectations, the basic expectations for dental settings with a nice checklist. It's a good starting point to use internally. And some people say, we don't have time to do it, or we've already done it. But do it again. Keep
Yeah,
find it.
doing it. So, if you have any offices, let's say you have the dental assistant, you have the hygienist like myself, and we're like, there are things that need to change. And you're just not being heard, you're not being taken serious, and maybe there are some potential like pretty serious violations. What do you like to coach people as like their next steps? I know There was a time in my career I was like, "Go straight to the dental board, like, call mom, get her on the phone right now, send it to the principal's office."
Mhm.
But I know that that's not always, like, best you're not gonna get as far maybe sometimes with that. Do you have any other thoughts?
I gotta remember, I work for the dentist,
Yeah,
the dental board, and
yeah,
I want to my job is to help them close any gaps, and so we provide a work plan.
mhm,
We will emphasize where to start first. And a lot of times we start building out their plans, their written policies and plans ahead of the visit so that by the time one of us or one of my trainers arrives, that portion is in place. And then fixing and tweaking any of the violations that we see. And sometimes it's a workflow problem where
yeah, I
like,
could see that.
yeah, the sterilization area is not ideally designed or it's a small building. And I'll tell you, I've learned over the years, Michelle, that you have to get people tuned into change. So I was
Mm,
working with a hygienist not too long ago, and I asked for him to step into sterilization area and give me his ideas of making positive changes. I already know it needs to happen, but I need these people to buy into it as
right,
their remedy
mhm,
because
mhm.
they'll probably launch it rather than, "Oh, that girl was here."
Yeah. Or I'll behave when that person it's very Hawthorne effect, right? Like, I only do the things while somebody's watching me, whereas that integrity isn't always attached to the behavior.
Yeah, I had one dentist recently that wanted me to come in unannounced, and so we did the training on a separate visit, and then I did just what he asked me. I showed up unannounced, and they all started looking around, and I found fast food in the sterilization the lab area, lots of violations that I typically would not find if they were preparing for my visit, and I thought that was a healthy thing for that dental
Mhm.
practice to do because, like I said, we are there to save them. We don't want them to have dental board violations or, heaven forbid, a plaintiff that files suit because they've been harmed.
I'm always surprised at the amount of clinicians, providers, people just in healthcare as a whole that will self-sacrifice and cut corners. Like, we talk about patient safety, but putting your food and sterilization could get you very ill. Not washing your hands could get you very ill. Not handling sharps appropriately could be very stressful. Not saying that you get a infectious disease every time you poke yourself, but like the steps to then figure out if you have an issue or anything develops, like that's a lot of time and work, but we just like self-sacrifice, like, oh, it'll be fine. It won't be, it's not that big of a deal. Like, I've been doing this for years. I'm like, why don't y'all love yourself more? Take care of yourself, protect yourself, put your seatbelt on.
Right. And one of the things that we see repeatedly, Michelle, is where the clinical workers, whether they're hygienists, dental assistants, or even dentists for that matter, are not wearing appropriate eyewear protection.
Yes, huge.
Young people, they've got those real pretty lash extensions. And,
And as someone who dabbles, you can find pairs at work.
and I'm worried about them. And we
Hmm.
talked to Dr. Peter Arsenault and I learned so much about his studies that I think is very, how would you say, pay attention before you have an eye injury or an eye.
Yeah.
And I don't ever go into the treatment room when there's a patient seated, but I'll walk down the hallways and look at the PPE. And 9 times out of 10, I'm leaving that office with violations noted for eye safety.
Mm. And that always amazes me because I love my eyes. Like, I like being able to see. I always joke that my eyes are about the only organ on my body that works to full capacity. Like, I would be so I like to protect them as much as
Yeah.
possible. And I'm always amazed at how many people don't wear the right eye protection or use something that's just not to the standard of Amy Anzi and not just true eye protection.
Yeah. And if you think about it for hygienists, Your eyes are an important component of your job.
Oh, 1,000%.
And your eyes, your ability to communicate. Without it, you could not be the clinician that you are. We joke about it with the attorneys. Matter of fact, I was in court the other day, and one of the local attorneys, he is early 80s. And when he got up to the judge, I reached over to an out of town attorney that was sitting beside me and I said, attorneys around here, they don't retire, they just die. You see all these old attorneys, and as long as their mind is working, they
Mhm,
continue to work, even if they have to delegate typing to someone else. So flip that around to a dental hygienist. If you can
mhm.
see, how are you going to work? And if
So true.
how do you pay your bills?
And that goes even as far as people putting their touching chemicals too much without proper gloves. Like for me, if my hands are bleeding because I have now contact dermatitis for whatever reason, not using the appropriate gloves, not doing proper hand hygiene, drying after hand, whatever it is, I'm
Mhm.
like, how are y'all working? I don't want to put more, I don't want to wash my hands again. I don't want to put Germex on. It's the same thing. You're not taking care of your eyes. You're not taking care of these are your money makers. What are we going to do if we can't make our monies?
I agree. And that's why we need one person internally that not necessarily is policing people, but
Mm-hmm.
motivating. Motivating.
Yeah. And India Chance used to say, I'd hear her talk to her clients, and she'd say something like, I don't want you to be the sheriff. Like, you're not out here micromanaging everybody, but you're really that person that has learned and educated yourself and have all the details, and you're a problem solver, really. So bring your problem to me. I'd love to find a solution for you so that you are safe and that patients are safe and that we are in compliance and that we're not breaking the rules. And honestly, I always say infection control and equipment maintenance just go hand in hand. We're doing the right thing for so many things if we heighten and elevate our knowledge and desire to do the right things via or by patient safety or with patient for patient safety, I should say.
But we have to be able to address issues when they come up. For
But
example,
yeah.
I represented a dental office with the HIPAA violation, and part of the discipline, so to speak, from the OCR, they wanted copies of written discipline for the violators. So, in other words,
Mm,
person in the dental office who violated the patient's privacy, they wanted written documentation that they were disciplined so that they would understand the seriousness of what they did and motivate and educate that it doesn't happen again. So,
mhm.
by the same token, when the need arises, are we disciplining an employee? For example, if they're not wearing their safety glasses because they don't like them, or they're not wearing the utility gloves because they're bulky and I don't like them, or I don't
Mhm.
like wearing a jacket, or whatever it is, then we provide training, we provide motivation. But if it's repeated, that's where we have to look at, okay, then
Right.
how do we discipline them and hold them accountable? Because this could be a
Yeah.
source of a legal issue.
And that's, I think, is that a part of a safety culture that we have a just culture where we have the ability to be that squeaky wheel and bring things without punitive action right there in the moment? But if it's on us and we're not making those corrections, I often say too, I'm curious if I choose not to wear all of my PPE and all my things, do I set myself up for not even being able to file a workman's comp claim?
That has been studied. Matter of fact, years ago when I was in
Oh,
law
interesting.
school, that was a case we studied where it was actually a utility worker who was electrocuted and was hospitalized and lots of medical bills. And the workers' comp denied the claim because the employer had documentation of training, specific personal protective equipment that had to be used. And he wasn't using some kind of special glove, and workers' comp denied it. And so that's an important component of making sure that employees are aware of the appropriate, that's the magic language, the appropriate PPE, where it is located. So they're not saying, oh, yeah, I had the training, but I couldn't find it.
Oh, okay. And so it's on the responsibility. So the employer is responsible for providing all of these things and doing the training, but it's also our responsibility to start asking questions like, where do I find it? How do is it in my size? Asking for the things that are proper. Would you say that?
Yeah. And
Yeah.
how do I put it on? How do I take it off? So with
Hmm.
cold months, as we are experiencing during this episode, it's
Hmm.
common for us to see people wearing long sleeve t-shirt under a scrub top. That is
Hmm.
not acceptable unless they're
Mm.
wearing a jacket on top. Um,
Yes.
so it's you have to wear protective clothing. And they're saying, my arms are covered, but how do you take it off?
Take it
Over
off.
your head, and you're cross-contaminating your face.
I say that all the time. What do y'all do? Y'all just out here getting naked at the office all the time? Every time you contaminate I don't know about y'all, but I prefer to not change constantly at my office. I'm like, what are y'all doing if you got soiled?
And I have seen pictures of you, Michelle, when you're in clinical attire, and I think you're doing a beautiful job of displaying appropriate PPE for hygienists. I love when I see hygienists wearing a cap, you know,
Hmm.
out washing our hair every day. Think about the contaminants in your hair.
Oh, yeah. What's so funny is that because I'm practicing 2025 will be my 25th year in dentistry, either as an assistant or a hygienist. And this is wild that I never even thought to put a scrub cap on. But also, this is just such a great example for anyone listening that I have not always been the pillar of perfection. I was the on the job trained assistant, hygienist, done some bad things in my career for my own safety. But I used to remember things hitting my hair, and I say, wouldn't it be fabulous if someone came up with a dry shampoo that was antimicrobial? I could just spray my hair down. Never thought to put a scrub cap on. But I was like, because I have always been like, my hair is disgusting when I leave here. I do Profi Jet back then. Now I do airflow. The aerosol generating procedures that I perform are just at the top level of aerosol generating procedures. It is, I think, so smart to be wearing scrub caps. I ebb and flow out of my face shield because I also ebb and flow out of my certain loops, and some work better with others. I need to get better. That's my own personal journey that I'm trying to wear a face shield all the time. But I'm always now wearing the proper mask. I'm always wearing loops that really cover. And I always wear gowns that have the cuffs, go down to my knee, have the neck thing. I just think that's so important. So I'm glad that I am setting a good example, but
Yes.
it took some time. I had to practice to get here.
But I think when one person is demonstrating proper PPE, it may model the behavior that they want out of the others, and it becomes
Mm.
contagious to do it correctly rather than cutting corners.
Yeah, and one thing that I would love to see less of from our dental profession, especially on social media, is the mask around the chin. I'm like, do you the medical waste that we're just putting on our face and leaving there?
Right, right. And I years ago, many years ago, when I was a young woman working in a dental office, I remember doing that, having the mask under
Oh,
my
same.
chin, and I ran to the bank to make a bank deposit for the office, and the teller said, "Are you going to hold us up?" And I'm like, I didn't even realize I had it on.
Yeah,
We want to be conscientious and don't walk into the break room with PPE on. That's another
yeah.
we note. That's a zone that's prohibited from PPE. Remove
I
it.
actually, sorry to interrupt you. I just saw Linda Harvey, I think it was a Dr. Bicuspid article, and she was talking about a complaint that had come because the clinical staff with all their PPE had come to the front office and was working on the computer with all their contaminated, if I was a front office person, I would be also upset and be filing a complaint. Thank you. No, I did not take B bloodborne pathogens. Like, I did not sign up for that. I signed up to do this front office stuff, this admin stuff.
Right. Yeah, and it should be restricted to the clinical areas. And with that said, acrylic nails, long fingernails, hand jewelry, that's really not the place for clinical people. And we have to issue those reminders. And I suggest that it be mentioned in the employer's handbook. So when we bring somebody on board, the most effective way, because if you give them a handbook to read, take it home and read it, they're not reading it. Have
Yeah.
them read it while they're on the clock, and may
Mhm.
even require that they initial every page that they've read it, and then they
Mhm.
sign the acknowledgement page, which is critical. They're acknowledging the employer's policies and procedures, and that may be the thing to do with these safety policies.
I think that's so smart.
Don't take it for granted.
As we close out, do you have any other like simple suggestions like that? I think a handbook is a great one, or anything that you're seeing on a routine basis. You're like, here's a quick fix for that.
Quick fix,
Yeah, I guess probably never a quick fix.
but I think if maybe at least one person internally can pursue additional training. For example, we are putting on an advanced training course next month. And I just really wish that one person per practice that we consult with would participate. And that's not the case. But it's 6 hours of digging down and understanding how the policies work, how to deal with complacency and non-compliance internally, and someone needs to carry that torch. In closing, I think that would be my final recommendation that, you know what, Michelle, if somebody's going to tune into this podcast, that means they care about dentistry as a profession. It's not just a job. And that's why they're listening to your podcast.
I hope so. And speaking of podcast and listening, you have one as well. I would love for you to tell us where people can learn more from you on a regular basis, maybe even bring you on as a consultant, all of those details.
My business name for consulting is Modern Practice Solutions, and my law practice is oliviawan.com. And I'm also very pleased to be part of the Compliance Divas. Myself, Linda Harvey, Leslie Canham, and Mary Gavoni. We meet every week and we discuss different aspects of compliance, whether it's OSHA, HIPAA, some HR issues, but topics that would be of interest to compliance people.
That's amazing. And I do really appreciate your time. I know you are a busy woman, so I definitely appreciate you coming on and speaking to the audience about that. And if anybody needs to do any kind of OSHA training, infection control, and you get Olivia's name on there, definitely sign up immediately. She does a great job.
Thank you, Michelle. Appreciated being on the show.
Thank you. Thank you for listening to season 3 of the Level Up. Don't forget to follow or connect with the guest. And while you're at it, follow me on Instagram, Level Up Infection Prevention. And check out levelupip.com for more details on all the digital courses and the Infection Control Coordinator's Guidebook.